Good afternoon, everyone, and thank you for joining our technical assistance webinar on these two exciting SBIR and STTR funding opportunities sponsored by the National Institute of Minority Health Disparities. Just a disclaimer, we are recording this session, so it will be uploaded within a few days to our website and YouTube, and I will send the participants to a link. I'm Lieutenant Commander Michael Banyas from the U.S. Public Health Service, and I am the NIMHD SBIR STTR Program Manager. I am thrilled that we have gotten so much interest for these two RFAs, and I am grateful for the strong partnerships we have gotten from our other fellow institutes and centers that will also be presenting on this webinar. Now, before we get started with introductions, just a disclaimer aside that yes, this is being recorded. Most of the information from this webinar can be found in the RFA. I did this on purpose. It's a very densely written document, but I want to make sure that you all have an opportunity to ask questions at the end, and that you have an opportunity to also gain an understandability of what is in the RFA. So the agenda going forward is, first, we're going to have a welcome from my division director, Dr. Nathaniel Stinson Jr. Next, we're going to have a quick overview of the NIH SEED program and requirements for SBIR and STTR applicants. That's the fundamental aspects of getting your DUNS number and what the SEED program is and how it's important to the NIH. Then we're going to be going into the specifics for both RFAs. Then we're going to be talking a little bit more about application requirements. And then my partner ICs that you can see listed below, not all of them are listed on the RFA that we've partnered with. They're going to be presenting on their own perspective on why these RFAs are important to their ICs and how it helps fulfill their IC missions. And then we're pleased to have Dr. Zhang Tao from our scientific review branch, who's also going to talk about the application review process. And then we're going to have attendee questions. So once again, this webinar is being recorded and will be posted within a week on the NIMHD website. And lastly, once again, all the information specifically about the overviews of the SEED program and the RFAs, those can all be found online. We just hope that we can help you digest the information a little bit easier during this webinar. So before I introduce Dr. Stinson, just general RFA questions could be sent to the NIMHD SBIR STTR mailbox. I know some of you have sent me questions directly. It just helps me ensure that I do not miss a question from one of you if you send it to this email box. Specific IC questions can also be sent to the Institute or Center directly, and their contact information can be found in the RFA. And lastly, webinar questions, please use the chat. So next, I would like to introduce Dr. Stinson. He's the Division Director for Community Health and Population Science for the National Institute of Minority Health Disparities. And Dr. Stinson is also going to highlight why this RFA is important to NIH and the Health Disparity Strategic Plan that can be found online, RIC, and carrying out the NIH's research and its role in the past. Dr. Stinson?
Thank you very much. I'm not going to take up too much time. I just wanted to say a couple of things. First, the National Institute of Minority Health and Health Disparities has been issuing a request for applications for the SBIR STTR program for the last 5 years. And one of the reasons why we wanted to issue an institute-specific funding opportunity announcement, we really wanted to highlight the importance of small businesses in developing products and interventions to really address the improvement in minority health and health disparities. We often think about the role of academic institutions and of foundations in fostering research and developing interventions, but we don't really give enough credit, to the work that small businesses do in their development of products and interventions that improve the health of individuals and communities around the country. And so we wanted to be very, very clear about what we had an interest in. We wanted to signal to the small businesses that we have set aside specific money to support these particular projects, and to reinforce, with everyone that this is an integral component of our strategic plan, on our long-term strategic plan to improve minority health and to reduce health disparities in certain populations around the country. So I want to thank everyone that has volunteered their time to participate in this a webinar. And we look forward to trying to answer, all the questions that, any of you have about this, opportunity to be part of this very, very important, research program that we have in our institute, and certainly look forward to applications from the vast majority of you on this call. So thank you again, and I'll turn it back over to Commander Banyas.
Thank you very much, sir. There we go. So first, I'm going to provide an overview of the NIH SEED program and requirements for SBIR and STTR applicants. One of the great things that I love about, I've worked all over the NIH, but one of the things I really love about the SBIR and STTR program is that you don't need to be on the scientific research track of getting your PhD or being a clinician towards applying for this NIH grant. It's a very wide applicant pool, but you have to still meet the requirements. And we are very lucky here as a program manager within an institute to have very strong support from our SEED office. And they have just launched a new website that is extremely helpful for helping applicants understand their requirements, but also what resources they have to help them move forward and be successful. So here is the SEED website. And as you can see, they've got resources for small business funding, support for small businesses, programs for academics. You can get information on portfolio, and if you want to know more about SEED. One of the other things that SEED helps coordinate is, and helps really provide the leadership on, is that ensuring that the small business program helps accelerate discoveries from bench to bedside. Now, above is the NIH Mission, which is to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. And SEED aligns that by helping for-profit entities and partnerships with academic research institutions, and helping take funding and investing in economic development to help translate that research from bench to bedside. Now, one thing I would definitely recommend to all of you in doing your application is make sure that if you're applying to an IC or anywhere in the NIH, definitely read their missions and make sure that your application aligns with the NIH mission. It's just so critical to know that the money that we're putting towards to invest in you, it's helping fulfill our agency's needs and our objectives to move forward for helping enhance health and lengthen life and reduce illness and disabilities. So as you can see here, this is the small business program. Now, our RFA is a part of a larger omnibus bill where Congress gives us money for funding the program. And the Small Business Innovation Research Program, SBIR, now all the NIH institutes, we divvy up about there to get collectively there was $1.1 billion in funding, and for the Small Business Transfer Technology Program, there's about 150 million. Now I'm going to bring about I'm going to definitely highlight the differences between the two programs because it could just so people aren't confused, but the SBIR program is for small business concerns to engage in federal R&D with the potential of commercialization. So that's one of the big differences between this and some of the NIH grants that you see out there, like an R01 or a U, is that this is meant for a small business to go out there in the private sector and to turn a product into a commercial product and help support the research system and health of the nation. For small business technology programs, this set aside is to facilitate cooperative R&D between small businesses and U.S. research institutions with the potential for commercialization. So that would be partnering with an academic medical center, a university, and so on. So just the eligibility criteria. So some of the eligibility criteria, and if you have more questions about this, my colleague Stephanie Fertig from the SEED office will be joining us for the Q&A, is that you have to be organized as a for-profit U.S. business, no nonprofits, I'm sorry. Small business is considered 500 or fewer employees, including affiliates. Work must be done in the U.S., with a few exceptions, and the RFA lists those few exceptions, and individual ownership. Greater than 50% of U.S., it must be greater than 50% owned by individuals and independently operated. Greater than 50% in control by other business concerns that are no greater than 50% in control by one or more individuals, an Indian tribe, an NHO, and SBIR, and just relating for SBIR only, it can't be more than 50% owned by multiple venture capital operating companies, a hedge fund, a private equity firm, or any of these combinations of these. So they can have a stake in the game in your business. They can have an investment, but it can't be more than 50%. So just some other critical differences is with SBIR, once again, the partnering requirement permits partnering. You can partner with other businesses, hospitals. I've had a couple of grantees working with federally qualified health centers or Indian tribes. You can do that partnering. Now in STTR, you are required to profit with a nonprofit research institution. The work requirement, guidelines may outsource. 33% you can outsource for phase 1, 50% for phase 2. And the minimum work requirements are 40% the small business needs to do the work, and 30% the research institution is allowed to participate in the partnership. Now, the principal investigator, the person on the FOA or the notice of the award, primary employment over 50% must be with the small business. With the PI and an STTR, they may be employed by either the research institution partner or a small business. Electronic submission. So grant applications and SBIR contract proposals must be submitted electronically. Now, this is something I would definitely recommend all applicants get a head start on, and don't leave it for, say, April 4th or even the first week of April, but get your DUNS number, get your system for award management number in SAM, get your grants.gov, register in grants.gov, get it to ERA Commons, register your company with with SBIR.gov, and grants could be submitted via the Assist or grants.gov workspace. And for contracts, well, this doesn't apply to contracts, so I'm not going to go into this space. So once again, these are the required registrations, and this is all within the RFA. One of the great things that maybe we could talk about towards the end is that while you're either doing your budget for your grant application or you receive funding, is that NIH has a variety of technical assistance and business assistance resources available, such as TABA, which is the Technical and Business Assistant program. Um, there's also additional education like the NIH I-Corps at NIH and the C3I program, which you can apply to after you find your award. And there's also other funding and support for phase twos, such as if you receive a phase two grant, such as commercialization readiness program and regulatory and business development consultants. And then once again, as you reach commercialization, there's a number of company showcases that the NIH participates in, such as BIO, which is being held in San Diego this year, the Angel Capital Association, which is in Atlantic City, and this year that's where their conference is, and a few others to show off your products and gain further support. Now I'm going to go into the overview of the SBIR and the STTR, and a lot of them are very similar, with the exception of the the partnering and the other requirements that I stated above. So for SBIR, there's that RFA is the overview, SBIR overview, healthy living, improving minority health and eliminating health disparities. And that's RFA-MD-22-004. And then the STTR is technologies for improving minority health and eliminating health disparities, RFA-MD-22-003. So one thing to note is only NCATS and NIMHD are participating in this RFA. So we are fortunate that we have had the support of a number of partner ICs. And within the RFA, you can see that if you have a product or you're doing a grant application that is, say, more related to cardiovascular or pulmonary or blood, you can directly apply through this RFA to the National Heart, Lung, and Blood Institute. If you have something dealing with imaging or bioengineering, NIBIB has participated. And here is the breakdown of the total cost ceiling for the awards and also the number of awards that they are giving out directly. So like I said, we are very fortunate that a number of our partner institutions have decided to set aside money to help fund applicants through this RFA or supporting health disparities, SBIR, STTR work within the NIH. So the purpose of the RFAs are to engage small business concerns in developing technologies and products that engage, empower, and motivate individuals and communities such as providers and healthcare institutions. So these RFAs are, meant to help small businesses, hone and develop and engage and work with others towards helping create products and services that help fulfill help further the NIH's mission that I had mentioned before. There is also an emphasis in these RFAs in supporting sustainable health promoting activities and interventions leading to improved health and healthcare delivery and the elimination of health disparities in one or more defined population groups who experience health disparities. And I'll go into more on how that is defined in the later slides. So within the NIH, there are designated racial and ethnic minorities. And that, once again, this is found within the RFA. So that includes Asians, Native Hawaiians, and other Pacific Islanders, African Americans and Blacks, socioeconomic disadvantaged individuals, such as those underneath the poverty line, sexual and gender minorities, rural areas, American Indians and Alaska Natives, and also Hispanic and Latino populations. So your RFA application should be targeting one of these designated racial and ethnic minority groups. Just some technology considerations for those of you that are applying to this RFA with a technology, with a technology platform. And the considerations include, you should talk about how your technology is effective in improving quality of care for racial and ethnic and health disparity populations. Is it affordable? Can someone in rural America or below or at a socioeconomic disadvantage provide, afford or or is there going to be some kind of cost barrier for them participating? Is it acceptable and suitability? Is acceptability and suitability for the population's culture and language literacy and level and content? Is it at an appropriate health reading level? Is it culturally appropriate, especially when you're working with Latino populations? Is it or tribal populations? Is it respectful of their culture, and is it going to help engage the community, or is it going to have a counter effect? Does it assist in advancing the mission of your organization? Every organization and business should have a mission, and your technology should help further that. Compatibility with the organizational culture of the customer. I'll give you a good example. If you're coming up with a product that is going to be inserted into that clinicians are going to be using, you should be considerate that, how is this going to fit into their clinical workflow? How is this going to fit into how clinicians treat patients or do research? Is it going to be compatible with their electronic health record system? Those are some things that you should consider. And can the proposal be combined with or embedded within current services or programs of the organization? So just like I said before, is it going to help create efficiency and capture reimbursement, or is it going to be a hindrance on that organization? And also accessibility or deliverable to desired populations, those who intend to use the technology. I will give you an example. One research program, I used the app to collect information. There were some issues there because the population we wanted to implement the clinical research protocol, and that population did not have broadband or smartphones. They had flip phones. So therefore, we did not make our technology accessible or deliverable to that desired population because there was no compatibility. Next, for the organization. Now, as I mentioned before, does this technology help further your organization? Is it compatible with the organizational culture of the customer? Once again, you're going to a hospital or a health center, or you're working with a human service component. Is this going to fit within their culture and their mission? Can the proposal be combined with or embedded within other services within the organization? And is the technology product accessible or deliverable? So I know the slides and these points are a little redundant, but they are so important as you formulate your application to illustrate these aspects. Some other research considerations. Are there going to be physical barriers? Are there going to be knowledge barriers? Infrastructure barriers? And some economic barriers, cultural barriers, and just some examples that are included are for physical barriers. These are factors such as proximity to healthcare facilities and transportation that might link access to healthcare, lack of transportation in particular, is a huge barrier if you're dealing with rural communities or even some urban communities where they might not have access to either that point of care or the service that you're providing. Knowledge barriers. This goes into health literacy and some of the technology considerations that I pointed above. If you're implementing an app or a program and it is at a college reading level or a high reading level, your audience might not understand it, might understand your technology and what you're trying to convey. Infrastructure barriers. You know, you just need to understand that rural or federally qualified health centers or even areas that have high poverty or social determinants of health, they're not going to have the same resources and expertise of large hospitals and health networks. So if you're doing a service or something that takes advantage of um, something that has a very well-staffed clinical care team, you should take into consideration that there might be staffing shortages or they might be acquiring that expertise in other ways. Economic barriers, lack of public and private insurance or financial resources. This is something I come from the federally health qualified center world, and which mostly deals with Medicaid. And this is something that's very important is that if you're going to be working with a health disparities population, know how, you know, what the insurance is and how the company might actually be able to attain reimbursement for these services, or at least attain economies of scale or bend their cost curve for providing services. Next thing is cultural barriers, and we talked about this above. And just make sure whatever technology you're implementing is culturally competent within your market and your customer base. Oh, sorry. Next thing is budget. So total funding support, direct costs, indirect costs, and fee. Normally may not exceed $259,613 for phase one awards and 1.7 30751 for phase two awards. There are certain topics that you can find, and there's a link within the RFA of special topics that are authorized under by waiver for exceeding these total awards. I would suggest you look at these. An example is for NIMHD, we give broad consideration for technology and health disparities focused applications. And then there's some institutes like National Institute of Drug Abuse. They look at some special topics such as substance use disorder, and other more specific topics. Applicants are strongly encouraged to contact the program officials prior to submitting any application. So if you're doing something that if you're submitting something that's diabetes oriented, you're going to want to contact NIDDK to ask them any questions about submission. Applicants should propose a budget that is reasonable and appropriate for completion of the research project. Project duration. According to statutory guidelines, so that means that it's in federal law that Congress passed, award periods normally may not exceed 1 year for phase one and 2 years for phase two. Applicants are encouraged to propose a reasonable and appropriate project duration period for completion of the research project. And any budget questions you have, my colleague Stephanie Fertig from SEED can help us answer that towards the question and answer portion. I would now like to turn this over to my IC colleagues who are going to be presenting on their objectives for their ICs. And I would like to first introduce my colleague from NIDA, who will talk about their participation in this RFA and how they and what how this RFA helps further their IC's objectives. Julia?
Hello, can you hear me?
I can.
Okay, sounds great. So my name is Julia Berzhanskaya, and the office at NIDA that manages Small Business Innovation Research and STTR Awards is Office of Translational Initiatives and Program Innovations, abbreviated ATIPI. Listed my colleagues, Leonardo Angeloni and Elena Kostova. You can ask all of us questions. Next, please. NIDA topics of interest are related to MD-22-004 and related to prevention, management, monitoring, diagnosis, and treatment of substance use disorders, that is opioid use disorder, stimulant use disorder, and other disorders, and supporting NIDA mission. So there is a hyperlink there, but of course you can find the NIDA mission on NIDA website, and I highly recommend checking it to have a larger picture of what NIDA is interested in. I have to point out that applications solely focused on alcohol use disorders are not accepted. But polysubstance use, which might include alcohol use disorder, together with other disorders, are accepted. This is very important for if you're pivoting your technologies into SUD field. For fast-track applications, NIDA encourages preliminary data that clearly support technical and commercial feasibility in substance use disorder field. Fast-track applications are large budget applications. They need to have commercialization plan, and of course, we welcome preliminary data in substance use disorder field. I would encourage you to look at other NIDA requirements that are available in programmatic descriptions for the main omnibus, and you can always ask me more questions. Please note that NIDA only considers SBIR proposals in response to this topic, so you have to apply to RFA-MD-22-004. You wouldn't consider STTR applications. NIDA funded research on health disparities, both funded through SBIR mechanisms and regular non-SBIR mechanisms, and potential academic collaborators can be found in the NIH reporter. So reporter NIH.gov. Michael asked us to provide an example. Of course, it's hard to provide an example in a very abbreviated fashion, but please check this particular grant, R41D. You can read the numbers. Culturally sensitive, evidence-based Spanish language model app for smoking cessation for Latino cigarette smokers. So that's all I have. And if you have any questions, I or my colleagues would be happy to answer. Thank you.
Hi, everyone. I'm Danny Gossett, a program officer at the National Institute of Diabetes and Digestive and Kidney Diseases. The research mission of the NIDDK is quite broad. It includes many chronic, common, consequential, and costly diseases, from diabetes to obesity to liver diseases to chronic kidney diseases to incontinence. Next slide, please. So to address this mission, the NIDDK's extramural research program is organized into 3 scientific divisions: the Division of Diabetes, Endocrinology, and Metabolic Diseases, Division of Digestive Diseases and Nutrition, and the Division of Kidney, Urologic, and Hematologic Diseases. And the NIDDK has program directors for each of these divisions who can advise you on the fit of your project for our mission and identify appropriate funding opportunities. Next slide, please. So the NIDDK is participating in the SBIR funding opportunity, RFA-MD-22-004. This is the NIDDK's first time participating, so we have no past successful applications specific to this program. However, you can find what we have funded in the past in the NIH reporter database. As I mentioned at the beginning, I'm Danny Gossett. I'm a program officer from our Division of Kidney, Urologic, and Hematologic Diseases, and I'm the NIDDK contact for this RFA. You can reach out to me directly, or directly to one of the SBIR program directors from our 3 scientific divisions, ideally with a draft of your specific aims page or project summary to confirm a fit for our programs. Thank you all.
Hi, everyone. My name is Stephanie Davis. I'm the Small Business Program Officer at the NHLBI. And so I'm just going to give you a quick overview of NHLBI's priorities and areas of interest in this RFA. So just as a reminder, the NHLBI is only going to be participating in the SBIR funding opportunity, so MD-22-004. So if you are interested or you think you'd like to participate, but you're not sure if you're eligible for the SBIR opportunity, please come talk to me. So to give you all some background on why we ended up signing on to this funding opportunity, NHLBI has always had a very significant interest in trying to ensure that we are supporting the development of new tools and technologies that not only treat heart, lung, blood, and sleep disorders in all patients, but specifically those in underserved populations. So last April, we had a workshop specifically focused on diagnostics and disease management tools for use in these groups. And if you could just click really quickly to show the next image. So without going into too much detail, we identified several different types of barriers that Lieutenant Commander Banyas went over earlier in his presentation, and noticed that these were leading to a lot of patients with heart, lung, blood, and sleep disorders from underserved or minority populations not being able to manage their conditions. So as a result, we signed on to this RFA to be able to better support the development of tools and technologies to manage heart, lung, blood, and sleep conditions in underserved patient populations. Next slide, please. So this slide shows an overview of the diseases that we are interested in. This isn't all of the conditions we're interested in, just some of the most prominent. But one thing to remember is that the National Heart, Lung, and Blood Institute, as the name would suggest, is interested in tools, technologies, and devices that can improve heart, lung, blood, and sleep health. And for this RFA, we're interested in tools that are specifically designed for low resource, historically underserved, and remote communities. I should mention that there is a caveat. If you're looking at lung or blood cancers, that's not in our mission space. That is under the mission space of the NCI, but anything else related to heart, lung, blood, and sleep health, we are interested in. Additionally, we are also interested in funding technologies that address barriers related to the implementation and dissemination of evidence-based interventions for heart, lung, blood, and sleep conditions in these communities. So if you have a technology that is of interest to patients with one or more of these conditions, please feel free to reach out to me and we can discuss whether or not your proposal might be of interest to the NHLBI. And I'm going to turn it over to my NINDS colleagues.
Hi, everyone. This is Emily Caparello. I'm the director of the NINDS Small Business Program. We are signed on to the SBIR version of this funding opportunity. And specifically for this funding opportunity, we are interested in research and development that is related to the validation, feasibility, and effectiveness of innovative digital health technologies, which can include mobile health, telemedicine and telehealth, health information technology, and remote monitoring devices. The indications we're interested in are broad and cover most of neurology. Specifically for this funding opportunity, we've highlighted stroke, vascular contributions to cognitive impairment and dementia, epilepsy, Parkinson's disease, traumatic brain injury, and pain, though our interests do span beyond these specific indications. We ask that applications address access, reach, delivery, effectiveness, scalability, or sustainability of interventions that target health inequality experienced by marginalized populations. At NINDS, we support budgets that are beyond the hard cap. Specifically, our website lists waiver topics that will allow phase ones to go up to 700K total with no more than 500K per year, and phase 2 applications that will allow budgets up to 3 million with no more than 1.5 million per year. Finally, we encourage the inclusion of community-based participatory research in applications to this RFA, and NINDS encourages applications that demonstrate diverse representation in the core leadership team. There is a link at the bottom to our Office of Global Health and Health Disparities Office, which you can take a look at to see more about our interests in this space. And the NINDS Small Business website also has information about funding through our program. Thank you.
For the NIH priority areas,
I would now like to introduce my colleague Mina from NCATS to present on their aspects, their participation in the RFA.
Thanks, Mike. Hi, everyone. Good afternoon. I am a program officer at the Office of Strategic Alliances at NCATS, and NCATS is really excited to partner up with NIMHD in these two RFAs. And just to give a little bit background about NCATS, it is the National Center for Advancing Translational Sciences, and we promote research that leads to the development of technologies and methodologies that ultimately result in, more treatment options to more patients more rapidly. So towards this end, we wanted to participate in this RFA. Again, both RFA-MD-22-004 and RFA-MD-22-003. I apologize why that doesn't show up in the slide though, but we do participate in both the SBIR and the STTR RFAs. Please be advised that NCATS, however, does not fund clinical trials. So just to keep that in mind. But towards this RFA, we are looking for supporting small business research in telehealth and telemedicine technologies and apps for improving communication among healthcare providers, between patients and families and physicians. And we also want to leverage electronic health records and communication technologies to deliver and evaluate interventions that reduce health disparities. At the bottom of the slide, we have our email address, which is actually all together. I don't know why it's split up, but it's ncats-SBIR-STTR@mail.nih.gov. Please reach out to us. We'll be more than happy to answer your questions and even, have a short conversation with you for about 30 minutes to see if your project is in alignment with NCATS' interest. Can we go to the next slide, please? Okay, here I just wanted to highlight some of the ways that you can engage with NCATS. Again, please do visit our website to learn about what NCATS has to offer to small businesses. And again, I do want to drive home the message that, the program officials at NIH Small Business Program and at NCATS are here to help you out. So please reach out to us, and I hope to talk to a few of you in the near future. Thanks. Back to you, Mike.
I would now like to introduce my colleague, Joy Tolver, to convey National Institute of Aging's strategic interests within this RFA.
Mike, hello,
Thanks,
everyone. My name is Joy Tolliver. I'm with the National Institute on Aging. Our SBIR program funds aging-related research and development, and our institute is the leader of federal R&D efforts to prevent and treat Alzheimer's disease and related dementias. So for the purposes of this RFA, the NIA is interested in all of the RFA topics as they pertain to Alzheimer's disease and related dementias. And we encourage applicants to reference the NIA's Health Disparities Research Framework when identifying and proposing solutions in response to this RFA. The NIA intends to commit $1 million total cost towards 3 to 4 proposals. And for proposals that fit our approved waiver topics, the NIA will not fund applications above the cap of $500,000 for phase 1 and $2.5 million for phase 2. And I do want to note that the NIA is only participating in the SBIR RFA. Next slide, please. So as many of you may know, racial and ethnic minorities are disproportionately affected by Alzheimer's disease. For example, African Americans are 2 times as likely as non-Hispanic whites to develop Alzheimer's disease, and Latinos are 1.5 times as likely. Yet, health disparity populations are less likely to be diagnosed with Alzheimer's disease. And when they are diagnosed, it's often in the later stages of the disease. And these groups do experience unique barriers to managing Alzheimer's disease. So there's a great need to develop innovations that aim to address these and related issues. And that's why we decided to sign on to this RFA. These innovations should consider social determinants of health, and they must be developed in a way, as previously mentioned by all the other ICs, that are going to be accessible, acceptable, and effective for one or more of the defined health disparities population groups that Mike discussed earlier in the presentation. So not just the general aging population. Special areas of interest to the NIA are innovations that monitor, evaluate, treat, or slow the progression of Alzheimer's disease in those populations. Innovations for the early detection and diagnosis of cognitive changes or Alzheimer's disease. Innovations that are going to prolong independence, improve care coordination and disease management, that are going to support aging in place in the home. Innovations that are combating social isolation, and also that aim to reduce the burden of caregiving. And lastly, we're also interested in tools and methods that increase the inclusion of racial ethnic minorities in Alzheimer's research and clinical trials. It's not listed here on the slide and not an application that was funded through this RFA, but it is related to this RFA. I did want to give an example of an application that we funded last year from COG Analytics for the development of a mindfulness mobile app that was targeted to African-American caregivers, really designed to reduce caregiver burden and aiming to improve the health of the caregiver as well as the quality of care that they provide to the person living with Alzheimer's disease. My contact information is listed here on the bottom of the slide, and I would be happy to engage with any applicants who are developing innovations that address these interest areas.
Just perhaps to clarify, I should say prospective doesn't review and know it could include the implementation of evidence-based interventions or practices.
Juan, can you put on the next slide, please? I would now like to introduce my colleague from NIMHD, Dr. Zhang Tao. He is the scientific. He is in our scientific review branch, and he is going to provide the guidelines for how applications are going to be reviewed and provide insight into the scoring process. Dr. Tao?
Thank you, Mike.
Thank you, sir.
Next slide, please.
Iterative updates.
Okay. I just transferred from the Center of Scientific Review, CSR. I did STTR, SBIR review for 3 years, so I have some experience. Even the topic are a little different. The application at the NIMHD. So since this small business application review is group as a SEP, a specific emphasis panel. So when I received assignment, I will look at the general topics. So then I recruit reviewers according to the topics. I also consider the reviewer representation. So each application will got assigned to 3 reviewers. Then we call the assigned review. It's not that does not mean only this assigned review decide the final outcomes. When the meeting during the meeting, all the panel member will participate in review each application. So the major review outcomes composed of 2 parts: the scores and the summary statements. So the overall impact score, I think somebody haven't muted. It's some noise. There's overall impact score and the 5 criteria scores. The scales from 1 to 9. The overall impact score is not an average of 5 criteria scores. So that's the review's notes, because the reviews weight criteria differently. So in reality, review weight significance and approach more than the others, but it's not definite. Okay. So then the final impact score is the average all the voting reviews. Then the applicant will receive the score from 10 to 90. That means that the 10 is the high impact, the 90 the lowest. So non-discussed application, because we set the application according to the preliminary score into lower half and up half. So we only bring the competitive application into discussion. So that means the non-discussed application will not receive final overall impact scores, but the criteria scores will show in the summary statement. So summary statement will contain a resume prepared by SRO based on the meeting discussion, plus 3 independent critiques by the assigned reviews. But non-discussed application will not have this resume prepared by the SRO, but they still, got enough information how their application are reviewed. So what's the reason, this outcome? The summary statement will be released within 30 days after the meeting. We have some, priorities, like maybe this RFA is easier, but if the application is coming from different institutes, so because this different IC have a different concert date. So yeah, but I guarantee that the applicant will got a summary statement within the 30 days. SRO is not allowed to discuss the review result. So that's a special design of the peer review system, because we want to protect our reviewers. Then after review, before the review meeting, the applicant can communicate with me with some issues, like supplementary material, something like that. But after the meeting, so you should waiting for the summary statement, talk to program official about the review. Next slide, please. Yeah, I think the applicant should know how the review evaluates application. I think the program officers already cover the majority part of this RFA. So then you first you need to be responsive to the RFA. So that's not a problem, because the program official will have the initial evaluation. If it's not responsive, then they won't come to the meeting. So when I receive the application, I would orientated reviewers, deem this application is responsive. So it's not the reviewers' responsibility to decide if it's responsive. Okay. Then very important for STTR, SBIR. So you should have a present, the commercial potential. So that's that's probably already covered by the program official. Then you need to convince the reviewer so your development have a multiple potential. So the review will consider 5 criteria. Then the significance. So that's in this part, you should tell, why you want to develop this technology and or service, the market lead, then that's the significance part. So you need to present a strong scientific premise and a brief review of a current situation. So we call the rigor of the prior work, then support the foundation of your development. So investigator, so you should include some good information in your biosketch. If SBIR normally have a multiple PI arrangement, you should present your MPI plan. So the review often look your biosketch to evaluate this criteria. So innovation is not it's not same as research program. So we orientate review focus on product and service, not just the science. Of course, science also very important. The approach, you need to present a very rigorous development plan with clear measurable milestones. Your data presentation, design and control. Yeah, so you should well present it. The phase 1 don't need the preliminary data. So that's the standard. So environment, the small business application have a very low bar for this part. You don't have a fancy lab or something like that, but you're supposed to present. You still have enough resources to conduct your development and research. Okay, that's enough. For this wet lab, we often say you even can do it in your garage, but you can use your collaborators' resources to carry on your work. That's the proposal that your application will be evaluated on a competitive basis. So even with orientate review to evaluate each application independently, but in reality, they will, compare a lot within this panel in their mind, So reviewers are requested to differentiate the application. So that's our the review's main mission. Then provide the information for the PO to decide the funding. In the review meeting, we don't talk about the funding, okay? But we need to differentiate them. So yeah, if we have a very strong score compression, that's not good for the PO make a decision. Next slide, please. Yeah, so probably I will skip this part because PO already covered this part. Next slide, please. Don't miss additional review criteria. I saw, the small business applicants, sometimes they don't have a very strong support from like a university. They have a grant office to support them. They often have some problem, missing this and missing that. Okay, they just pay attention because the reviewer will look at. They will, have some. If you're missing something, you will have a negative impact for your scores. So the additional criteria divided into scorable and the non-scorable. The scorable, that's if you're doing clinical trial, you should present a good study timeline, the recruitment plan. Okay, for the human subject, you should present a good protection. the other thing review, the applicant often missing this is inclusion, like both gender or age span. In recent years, this part has been emphasized a lot. Just pay attention on that part. So if your study involves some vertebrate animal use, so you also need to consider sex as a biological variables. Okay, use a single sex is if without justification, that will affect your scores. Yeah, we still have a non-scorable. Just follow the instruction, fill each part without leaving it blank. Okay, yeah. Next slide, please. Yeah, I put this hyperlink there, but you can review. You can easily Google it. You find that from the internet. So I see. Okay, our PO already covered, these specifics of these two RFAs. You also can easily Google this review guidelines for the small business. Then you see more details there. Next slide, please. Yeah, the other thing I want to bring up, that's the grantsmanship. A lot of small business grants applicant, the first applicant, they don't have experience. Then sometimes they will have kind of a problem in the grantsmanship. Very often things is the page limitation. You have follow exactly the rules the NIH stated. So you also have the matched and the updated batch sketch. Sometimes you have multiple PI. You're missing one or two batch sketch. Within the batch sketch, people will have the personal statement is actually for other application, not the particular for this one. So as a principal investigator, before your submission, you should do the proofreading in very detail. Okay. And the other thing is the problem, that's data presentation, missing mislabeled legends, consistency, like your cohort size, here is 100, there you become 80. So that generates some problem. Okay. Yeah, if you have a collaborator, you need you got a support letter, you should read the letter. They will indicate to support this particular project. Okay, so other things, clinic trial. If you, because NIH have a clear definition for clinic trial, don't miscategorized. Okay, that also can risk withdrawal of your application. So the resubmission, I guess probably that's not the problem here. I know normally RFA don't have resubmission. So if this recurring RFA could have resubmission, then you have the introduction. But if you submit again, if your A1 failed, you come back with a new application. Don't mention the previous review information in your application. Next slide, please. Yeah, review integrity, that's also very important. So do not contact the reviewers. So the meeting roster will be published 30 days before the meeting, then you will see the name of this meeting. I don't know, this is meeting will have a independent roster or grouped, okay? But even that some people don't try to contact them. Okay, that's a serious the integrity issues. Yeah, after your submission, after I receive the whole package, I will send everybody a welcome letter. So you will read carefully. I will instruct you what to do next. There's a acceptance of update and correction the rules. So like you after submission, before 30 days before the meeting, you have a new publication. Okay, you can send to me to update. There's a pandemic related policy for the supplementary preliminary data in one page. I think this rule also apply for this RFA. So all those additional the material should send via your organization representative. Okay, so not sent by the PI directly to me. So I'm not allowed to upload this information sent to me directly. Next slide. I think I won't talk about this. This the when you your application submit, you will receive the meeting code. So this slide just tell you what that means. Okay. That's all. Thank you.
Hi, everyone. Thank you very much for participating. And I would like to thank my colleagues at the NIH also for presenting on their different subject matter expertise areas. We're going to open up the webinar for about 20 minutes of questions. You can put your questions in the Q&A. And once again, any general RFA questions could be emailed at NIMHD SBIR STTR at mail.nih.gov. Webinar questions, please use the chat. And also, I know that there was a question about specific email addresses for IC contacts that can be sent to, that can be found in the RFA at the end, at the very end of the document. First question that I have is regarding budget, and my colleague Stephanie Fertig, the SEED office, is also joining us. And Stephanie, there was a question about the budget cap for phase one. In the RFA, it's listed as 259,613. Is there an updated number of 275,766 for phase one?
Sure. So I think the difference here, and hello everyone. Glad I could, hopefully answer, any specific questions you might have. So there is a difference between the SBA budgetary cap. So as many of you know, there's guidelines from the Small Business Administration for the small business program, but individual RFAs or PARs or PASs may have their own budgetary guidelines. And again, depending upon how an RFA is written, it may be a guideline versus it may be a hard cap. And so again, I think it's important to note that while we do have this guideline from the SBA, the NIH does have a waiver to exceed that guideline for specific topic areas, and those waivers are available online. I'm happy to put those into either the chat or have Michael, you can be happy to pass them to you for you to put them in the chat, either way. But we do have waivers to exceed those budgetary guidelines. However, for this specific RFA, I would pass it to, my guess is it'll be a little bit institute dependent. It often is. And many institutes and centers at NIH may have their own budgetary guidelines above or around that cap. So hopefully that should help. And I think certainly the individual institutes and centers who are on can talk a little bit about their budget guidance.
Thank you very much. So
Yeah.
In the first go ahead, Dr. Stinson.
So I was going to say, historically, what NIMHD has done in these funding opportunity announcements, that it has issued in the past. If there was an official change in the CAP guidance, then we essentially adhere to that change. So this RFA was written at a time where there was a lower number, and in January that number was increased up to 275,776 for phase one, and 1.8 and change for phase two. So any particular applicant who was proposing a projects within those particular dollar amounts, they would not have to worry about coming in and requesting a waiver or anything like that. But above that, obviously, as Stephanie has mentioned, there are certain provisions as far as seeking a waiver for higher budget amounts. But when there is a change in that, after we've already published it, when the applications, we allow applicants to come in at the higher level.
Do any of my other IC colleagues want to comment? Okay. Next question is there an advantage of responding to the RFA SBIR, such as the one that this webinar is focusing on, or just submitting to the general SBIR program? Stephanie and Dr. Stinson, please correct me if I'm wrong, but with this RFA, not only, as Dr. Stinson said in the beginning during his introduction, it is a narrower scope of what the NIH ICs, such as ourselves and my colleagues have presented, are looking to fund, but also from the review standpoint, it goes to a special section of people that have a familiarity with health disparities to score and review these awards versus the general omnibus SBIR, where that is a much wider latitude for how the applications are reviewed.
Yes, I wouldn't say that there's an advantage or disadvantage of applying to this, FOA, this funding opportunity announcement versus the, NIH parent SBIR announcement. It really all depends on the small business and what they want to do. What requests for applications often do is they often provide a little more specificity as far as what the institute is looking for in any particular application, and it also makes a commitment to set aside a certain amount of money, meaning there is an intent to fund a certain number of applications that come into this funding opportunity announcement. For the parent SBIR funding opportunity announcement, institutes, don't make any commitments of funding any applications that come in. And so I really don't see that there's really one advantage or another. It's really about whether or not there's something in this particular funding opportunity announcement that really fits what you're really interested in.
I don't have much to add, actually. I think that's a great summary, and really is the difference between general omnibus solicitations and RFAs. RFAs have this specific set aside amount and may have specific review criteria or specific review groups, versus the omnibus solicitation is more general and is more broad. So it really depends on what makes the most sense for your specific project.
Here's a question as far as applying under this RFA to two different ICs that have overlapping disease areas, such as diabetes or blood disorders. Can someone apply to both NIDDK and NIHLBI within this RFA, or do they need to choose one or the other? Stephanie, what do you think? I would have to say one.
No. Let me answer that question if I could. It's not a matter of the applicant deciding which IC I'm going to apply for and which one I'm not going to apply for. When you're have a particular area of science that maybe some particular, overlap. You really need to really just focus on writing a very good application to accomplish what you're basically, interested in. What will happen when applications come in, then the review office, along with, in this particular case, along with the other scientific, staff that's part of this, joint initiative between these ICs that are signed on to this, we'll make a determination of, what, where that application really fits from a science point of view. And for applications that have a clear, overlap, what we will likely do is we'll assign one IC primary and the other IC secondary. So if one IC that's assigned primarily, isn't able or isn't interested in funding that application, the other institute that is secondary also has the opportunity to fund that application. So if there are areas that really overlap the interests that we have, from ICs that we have put in the funding opportunity announcement, if it really does, fit both of them, we would, essentially, have primary and also secondary ICs, and all of those ICs that are designated as one of those two would have the opportunity to be able to fund that, application.
Now, thank you very much, Dr. Stinson. Does anyone else have anything to add? The next question is are Canadian universities eligible for participation in STTR? I know in the beginning we touched about the restrictions on foreign individuals applying, but Stephanie, can Canadians apply?
So I think that the specific question here is about having a partnering institution that's outside the United States, and unfortunately,
yeah, Canadian university, you're correct. Yeah.
Yeah, unfortunately, no. It has to be a U.S. nonprofit research institution.
Okay, excellent. Okay, thank you very much. The next question is in regards to commercialization efforts. Is there any good commercialization examples that someone can look at for their application? And one thing that I forgot to highlight in the beginning is that there's some good example applications on the NIAID small business website. They have a success stories area with a bunch of sample applications that scored extremely high that might be good examples. But I don't know if any of my other colleagues have something else that they could also suggest.
I'm happy to. What I'm going to do is pop into the chat the website that has the links of all the different, because a number of institutes and centers do have sample applications available, and we have compiled all of those into one place on our SEED website. So I'm going to pop that into the chat just now.
Okay. Next question is, are individuals with disabilities considered a health disparity population, regardless of racial and ethnic status, or would it have to be an intersection of those two demographics? Now, Dr. Stinson, this is a special population I know you and I would have to discuss, and I would have to say that individuals with disabilities are not considered a health disparity population. Is that correct, sir?
Right, that is correct, and I answered that question in the Q&A.
Okay.
Right now, individuals with disability, are not a designated health disparities population. There's a process that NIH goes through to designate certain populations, the populations that Commander Banyas listed earlier in the presentation. The projects would have to predominantly focus on individuals with disabilities from designated, health disparities populations. So either one of the racial and ethnic minority populations or individuals that are low socioeconomic or from underserved rural areas or sexual and gender minorities.
Next question is, the RFA lists the expiration date of April 5th, 2022. Is there any chance that it will be extended? No, we've actually had this discussion, and
yeah, we have to make awards, this fiscal year, and with the issues around the length of the time it's really taking Congress to pass a budget, and the time and effort that it takes for the review group to conduct the review and prepare the summaries, and then the grants management. It's just it's incredibly tight for this year, and then there's no way to really extend it for this year. Although I will also say, historically, we've tended to put out this type of funding opportunity announcement, every year, and I would suspect that would be the same in the future.
Yes. The next question regards outsourcing work, and this was something I had touched upon in the beginning with the SBIR guidelines, and that's if you're using independent manufacturers of products that are outsourced, how is that viewed against the 33% cutoff? So you're only, for phase one, you're only allowed to have 33% of your work outsourced. Stephanie, I don't know if you have any insight into that.
Absolutely. And that question of outsourcing, the thing to remember is that the outsourcing, that 33% outsourcing, that's a guideline for the SBIR. The STTR has different guidelines, has different hard and fast rules. So the STTR, for an STTR, the company has to do at least 40% of the work. The partnering organization has to do at least 30% of the work, which leaves 30% of the work that can be done by either of those two groups or an additional third party. For SBIR, as you noted, it's 33%. So for STTR, those are rules. It has to be at least 40% by the company, at least 30% by the partnering institution. For SBIR, there's a little bit more flexibility, but that is up to the institute. Each institute and center determines whether or not they're going to provide any flexibility there for the SBIR. And I would encourage you, if you do have questions around the subaward and how much you can provide, you can outsource outside the company. The new Forms G has more information and more guidance on this specific issue, including what counts as a subaward versus what counts as a fee for service. And I would also encourage you to look at the frequently asked questions that occur on the SEED website. That's the main SBIR website for NIH. There are some clarifying information there as well. And so there's a number of different places you can find out information for that outsourcing.
Yeah. Stephanie's office and the SEED team, as I mentioned in the beginning, launched a brand new website. It's extremely user-friendly. There's great information on there, and I would definitely go through it and see what resources are available for both developing your application, but also answering some of these technical questions. In fact, a lot of the ICs have fantastic websites that offer those types of resources. One last question. Our research interest is in ADRD with huge disparity in both African American and Hispanic men. We want to target both, or we should only target one minority group. Well, that's something you can have a conversation. You can email me and we can have that conversation. But as Dr. Stinson had pointed out, you want to put yourself in the best possible position for successfully writing a great application. And that's the most important thing, is to follow the RFA's directions and to come up with a proposal that is looks like it's going to meet the criteria, but also have focus for success. Sir, is that correct?
Right. So you need to really obviously write an application, to your strength and to the science that you're really interested in. This program and the interest of all of the participant ICs aren't for one particular health disparities population versus another, and it's really a scientific decision on your part whether or not your research project or what populations your research project include. They're judged on their merit. Having a research project that focuses on two health disparities populations doesn't give you any additional credit versus one if the science of the project isn't strong. So really write to your strength, write to your interests, and usually that's reflected in a better application.
Do any of my other IC colleagues have any closing thoughts or advice as we wrap this webinar up?
Let's also give people, we have a little, additional time here in
Okay.
case people think of any other questions. We allowed a time up to 5 o'clock.
Okay.
And I'm just looking through the Q&As to see if there are any questions in there that haven't been answered yet. But we still have a little time.
Okay. Dr. Davis, I just made you a participant again. So you're
Thank you, Commander Banyas.
So one question that I have gotten, I got this yesterday, was, and it would be interesting to hear Stephanie and Dr. Stinson's perspective, was they were thinking of submitting a direct phase 2 and a phase 1 for two different health disparities populations. Both SBIR, one was focusing on Caribbeans, and then Black Caribbeans, and then the other one was focusing on Hispanic senior citizens. Could they submit two different application types using the same technology, but focusing on two different health disparities populations, but the project was at different stages?
Yeah, the decisions about whether or not the applications represent something that is problematic really depends on the science. It depends on whether or not there's scientific overlap between the different applications as far as the design of the research project. So yeah, as long as they're scientifically distinct, there's not a particular issue of submitting multiple applications as long as they're different.
Okay. Next question we have, should we mention in our application for phase 1 the results of our own research that was informed by a phase 1 grant that was just concluded? So it is my understanding that data can help inform your proof of concept. However, if you're applying for a direct SBIR2, you cannot receive a phase 1 application, or you cannot receive an application for something that was previously funded by a phase 1. And Stephanie, I know I kind of probably jumbled that criteria, so if you can put it in better terms, I'd appreciate it.
Sure. No, I know this is a complex issue, and I totally appreciate that. So first, I want to say, for this individual, you're interested in submitting a phase one. You can certainly talk about prior work that you've accomplished that could potentially support what you're planning to propose for that phase one. So that's the first thing. For a direct to phase two, NIH has the ability to issue and accept direct to phase two submissions, regardless of the funding source for the proof of principle work, for what that research that proposed phase two is based on. So we don't care what that funding source was. However, it's really important to note that for direct to phase two awards, they need to be submitted as new applications and not continuations of prior projects. And that's also true of that phase one. It's not a continuation of your previous phase one. So the small businesses, if you are eligible to submit a phase two, and that is the best, we always encourage people to submit a phase two application if a project was supported with a phase one and they're eligible to submit that phase two. However, if you would like to submit if somebody is at the point where they're interested in a direct to phase two, we do not look at funding source. But again, it's important to note that's considered a new application. It should not be phrased in the application like it's a continuation of that phase one project. So I hope that helps. I know it is a complicated issue, and I'd encourage you for your specific situation to reach out and have a conversation with program staff. That's a great reason. And hopefully everyone is taking from this webinar that program staff is here to help. We're here to answer questions. And we'd really like to assist you as you're looking at submission.
Thank you very much. And they can use the letters of support from that phase one for whatever they apply for. So the next question, this is actually a really interesting one, was they are a U.S. company that meets all the requirements of an SBIR grant. However, their PI just had to move to Japan. Is there any, can they still apply for an SBIR grant? And if not, is there any support or partnerships that the NIH can help with? And,
Mike, it says move from Japan to the U.S.
Oh, okay. However, the PI just.
So I'm not sure exactly what the
question is.
The question is asking, but I did put an answer in there saying that the grant can support IT services, if that's the question.
Okay.
I'm not sure what it means by doesn't have the network yet, but it says move from Japan to the U.S. So.
Okay. Here's a question. Is an LOI required? Does anyone know what an LOI is?
A letter of intent. No.
Letter of intent. Okay, yes.
Yeah, they're not required. The letters of intent assist the review office in getting an idea of how many applications may come in, so they can make arrangements for the number of individuals that they need to be on the review panel. But it's helpful, but not required, and it's not binding. I mean, you may submit in a letter of intent, but decide that you're actually not going to apply for the applications. There's no consequences for doing that.
Thank you very much. And you can find the contact information of who to submit a letter of intent to within the RFA. Next question is there any agency specifically encouraging or interested in ed tech projects? I don't know what an ed tech education technology project. My answer would be you could submit whatever idea or funding, or whatever idea or concept, as long as it aligns with the criteria of the RFA. Next question is, are PI or PDs required, position descriptions required to have an MD or PhD expertise? So the way I interpret this question is do you have to be an MD or a PhD to apply? And if that's correct, then the answer would be no. That's one of the great things about SBIR, STTR grants is that you don't need an MD or a PhD or what you would traditionally need to like apply for a research grant from the NIH. This has a very broad applicant pool or applicant audience. You just need to follow the RFA's instructions. Stephanie, here's a question about TABA. Is the TABA program funding part of the SBIR R&D budget, or is it a line item outside of the R&D budget?
That's a great question. And
That's a good question.
I have to tell you, I was wondering if we were going to have a TABA question.
I did bring up TABA in the seed slide, so
I would be shocked. So here's some good news. We actually provided some additional instructions around technical and business assistance in the new Forms G instructions. So I would encourage anyone who's interested in requesting TABA to look at Forms G. Specifically, it is in lines 8 through 11. So if you look at Forms G, you can see it is listed kind of alongside with the subawards and is treated there. What puts it out as a separate cost is, so it is lumped in there with the overall cost of the grant. But what's important to note is that the technical and business assistance is treated a little bit differently because it allows you to do things that you are normally not allowed to do within the SBIR and STTR. And that's what makes the technical and business assistance so important. So if you're thinking about doing technical and business assistance and you have questions about what is allowable, what's not allowable, and how to request it, I'm going to put a link into the chat for the technical and business, the technical and business assistance funding, basically how you can provide, how you ask for support within a grant application. But hopefully that will answer your questions. And then we also have frequently asked questions specifically associated with TABA, and that'll help provide guidance. And if you still have questions, then reach out, talk to us. We'll be happy to help.
Here's a question. Thank you so much. Here's a question about letter of supports. Do they have a statute? Do they have time limitations? Like if someone had a letters of support from half a year ago, is there an expiration date, or should they, what is the consensus on how old they should be? And I don't know if Dr. Tuo wants to answer that question.
I actually don't have this, the time, the rule about the date of the support letter, but reality is, you finish you have your idea, recent idea, you build up your application, you ask somebody support. It must be a recent activity, should not be long ago. Okay. Yeah, something related to the supporting letter, the applicant should know we have a tighter conflict interest rule. So, for example, you got a support letter from, Yale, the whole year application, people cannot review your application.
Yeah, that's a good answer. I don't think there's really any hard and fast expiration date. However, if you put in an application and you have a letter of support from 2 years ago, reviewers may question whether or not that support really is still there now. And so it's I know that a lot of times it's burdensome to, to frequently go and get organizations, to write a letter of, support for the particular, project that you're interested in. But it's always worth the time and effort to make sure that those letters are relatively current.
Here's a question regarding IRBs that I think is very interesting. The question is they need to perform human testing of a tropical skincare products that have met in VO FDA testing requirements for safety. Since it is not done at the university under an IRB, what documentation do you request to confirm consent to participation? So I guess this would be a clinical trial question, or I'm trying to figure out what bucket this would.
Well, it's at least clinical. It's at least clinical research. It could be, a clinical a trial, depending on how they design the project itself. But the short answer to that question, if you're doing research that involves, human subjects, then you need IRB approval. Although universities, have the infrastructure to review research projects and give IRB approval, there are also private organizations out there that provides the same type of services and review and documentation for other entities that don't have that in-house. But if you're doing research with human participants, still need IRB approval.
Yeah, that's a great answer. And to give you a much more firm example, I have an SBIR awardee who works with tribal populations, and there is a tribal IRB, a private one, that they go through to for their consent in their clinical testing. So they are out there. Next question is in phase one. Oh, it just moved. I was wondering if we could. I was wondering if we could talk about how the commercialization plan for a phase one is going to be reviewed. And Dr. Tua, I didn't know if you could provide some indications of that.
Okay, my experience is, the different of small business application with R21, you have some plan in your mind. Okay, so first you will tell your product or service is highly, needed in the community. Then probably you need to do a little review of the current market status, your potential competitors. But you don't have to be, use a lot of space for that part. But you're gonna to tell the reviewers. So those things already in your consideration. Okay, that's very important.
Okay.
And I'd like to add just very quickly a point of clarification. Keep in mind, phase ones do not have a full commercialization plan. Only phase twos or fast tracks have a commercialization plan. Phase one should make sure that information about the commercial potential is included as part of their significance. So the significance, why is this significant? Why would this be considered a significant proposal? As well as with regards to innovation, you can think about why is this product going to be innovative. So you should be putting some of those components of commercialization within the research strategy, but there's not a separate research plan for a phase one. Right, a separate commercialization plan for a phase one.
Thank you. Well, we're at 5 o'clock. I think we got all the questions. Once again, if any questions come up, please contact the IC contacts within the RFA, or you can email NIMHD, SBIR, STTR at mail.nih.gov. And once again, we will be sending out the recording, the link to the recording to all the participants. And I just need to touch base with our communications department about sending out the slides or where they can be downloaded for 508 compliance reasons. But thank you very much for everything. And oh, we got one more question. If your product is being built in stages and your stage 1 is in production, can you still apply for a phase 1 or go to phase 2?
If you need technical assistance during your call, press 0.
I would have to say that, Stephanie, I would have to say that they should look into a direct phase 2.
Potentially, yes. And again, it really depends on those different phases. You know, one person's feasibility study is another person's further research and development. This might be something, and this is kind of one of those specific questions that's great to reach out, put some of that information into an email and reach out to the program staff and have a quick conversation to see what makes the most sense for your specific project.
Well, this is the end of the event. Thank you very much for all the participants and good luck with your applications. And please let us know if you have any questions. Thank you very much.